What is Wernicke syndrome? Wernicke syndrome, also known as Wernicke Encephalopathy, is an acute neurological disorder caused by thiamine or vitamin B1 deficiency. It commonly affects individuals with chronic alcohol use disorder. However, it can occur in any situation where thiamine absorption is compromised. The condition is a medical emergency requiring prompt recognition and treatment. Thiamine's role in brain function. Thiamine is crucial for glucose metabolism in the brain. Inadequate thiamine levels impair the brain's ability to use glucose for energy. This leads to neuronal dysfunction and potential cell death. Brain regions most affected include the thalamus, mammillary bodies, and certain brainstem areas. Classic triad of symptoms. Wernicke syndrome typically presents with three key symptoms: ophthalmoplegia, ataxia, and encephalopathy. Ophthalmoplegia refers to eyes' muscle weakness causing double vision or involuntary eye movements. Ataxia refers to loss of coordination and balance, leading to unsteady gait. Encephalopathy refers to mental confusion ranging from mild disorientation to coma. Not all patients exhibit all three symptoms. This classic triad has been reported in 16% to 38% of patients. Recognizing even partial presentations is crucial for diagnosis. Other possible symptoms. Additional symptoms may include hypothermia, hypotension, and numbness or peripheral neuropathy, tingling in extremities. These symptoms may accompany or precede the classic triad. Diagnosis. Diagnosis is primarily clinical, relying on the recognition of symptoms and the patient's history, particularly regarding alcohol use or nutritional deficiencies. MRI usually shows symmetric signal intensity alterations in the thalami, mammillary bodies, tectal plate, and the periaqueductal area. Importance of prompt diagnosis. Early diagnosis is critical to prevent irreversible brain damage. Diagnosis can be challenging due to variable symptoms and coexisting medical conditions. Maintain a high index of suspicion, especially in at-risk patients. Consider Wernicke syndrome in patients with chronic alcohol use, malnutrition, or impaired thiamine absorption. Treatment. The primary treatment is immediate thiamine supplementation, typically given intravenously or intramuscularly. This ensures rapid absorption and distribution. The typical dose of thiamine is 500 mg TID for 3 days, followed by 250 mg per day for 5 days or until clinical improvement plateaus. Avoid glucose administration before thiamine replacement, as it may worsen symptoms. Supportive care is also essential. Correct electrolyte imbalances. Provide adequate nutrition and hydration. Manage underlying medical conditions. Treatment should address both acute symptoms and overall health status. Long-term implications. Prognosis depends on deficiency severity and treatment timing. Early intervention can reverse many symptoms. However, potential long-term effects include Korsakoff syndrome, a chronic memory disorder, cognitive impairments affecting memory, attention, and executive function, persistent balance and coordination problems. Understanding these potential outcomes is crucial for patient education and management. Prevention. Preventing Wernicke syndrome involves 3 key strategies. 1. Increase awareness among the public and healthcare providers about thiamine deficiency risks. 2. Implement thiamine supplementation programs for at-risk populations. 3. Address social factors contributing to alcohol abuse and malnutrition. As healthcare professionals, you play a vital role in these prevention efforts. Take-home message. Wernicke syndrome is a serious but preventable and treatable condition. Maintain vigilance, recognize diverse presentations, and initiate prompt treatment to improve patient outcomes. Your understanding of Wernicke syndrome can make a significant difference in patient care.
Thank you for watching. Please subscribe to our channel by clicking the subscription button. If you have any questions, feel free to leave a comment below in the comments section.